Hey guys, this is CEO Ty with Educationally Speaking Center for Learning, and we are the bridge that connects the child to the curriculum. Welcome to our broadcast today. I am so excited, first of all, because we're going to be talking about children with ASD on the autism spectrum disorder. And I'm taking off my glasses. I hope I can see because there's a glare. But we're talking about children with autism and how to help them effectively communicate at home, especially now that we're in this pandemic. And so I have an amazing guest live with me today, Miss Quintina, and she's going to introduce herself. She's going to talk about her business, and then we'll move from there. So if you have any questions, please make sure you drop them in the comment section so we can address the questions. But today is going to be all about autism and how to assist a child with autism and just effectively communicating at home. So, Miss Quintina, let's go.
All right. So thank you so much, CEO Ty, for having me on your broadcast. I'm more than grateful, as well as Pediatric Speech Lab, just to reach another platform that will assist us with getting education to our parents and also to our clients, whether they're little babies or big babies, it does not matter. So thank you so much, Ty, for that. We appreciate the invite. So my name is Quintina Briscoe. I'm a speech language pathologist in the DC and Maryland area. I also have a pediatric speech and language practice that is going teletherapy right now, which is like the best time for teletherapy at the moment.
Listen.
So we have been doing teletherapy for quite a few months now, but we are recently expanding the practice to the East, basically to the East Coast, like New York, New Jersey, Philadelphia, Pennsylvania, DC, Maryland, and Virginia. So that is where we are expanding our practice to. And that's about it.
Amazing. I also tell people that if you have a business, I know everybody is freaking out right now about the whole pandemic. I'm sorry, but this is the best time, especially if you're in the field of education, to step outside of the box and broaden your horizons and just you can expand your business and your reach to parents who've never heard of you, who need this service, but they may not be in your area.
Yeah.
And if you have a unique service, because I want to talk about your app as well.
Sure.
If you have a unique service like this, it's an amazing resource. So let's start off with that. Let's talk about your app. What is your app? Why did you create it? And then what does it do?
So the app was created. This was something that I prayed about. I'm a very spiritual person. And God actually showed me that what the need was in speech pathology. And immediately when I jumped into this app thing, and thank you for bringing that up, because sometimes when you're working towards a goal, and there's that period of silence, you're kind of like, okay,
what's going
on? What are you going to do? So, and I can clearly hear him saying that I've given you a vision, and this is what I want you to do with the vision. So the vision that I had for the app, and it has been coming along very well. So I've realized that a lot of parents, well, first of all, there's a shortage of speech language pathologists. And instead of me continuing to say that long word again, I'm going to say SLPs. How about that?
Yeah.
So there is a shortage of speech and language pathologists. And a lot of times I started getting parents and families who were saying, okay, Miss Tina, you gave us 30 minutes or 2 30-minute sessions. What do we do next?
Right.
So those parents actually wanted something to do next. And I let my parents know, and it's crazy because I just emailed a family yesterday. I want your child to be in speech, but what I don't want to do is prolong his progression.
Right.
So whatever you can do at home, whatever we can do here, it'll be amazing. I mean, you'll be out of speech pathology, you'll be out of these services within a month or two. I mean, I don't know, but depending on the diagnosis, you could be out quicker. So that was my main goal, was to find something to assist the parents outside of the session. It has worked tremendously. I mean, I'm very grateful.
And I love that because when a child has speech language services, it's different. And some children just have IEPs for, speech
and language. Yes, ma'am.
So very different. And a child can test out of speech and language, faster than they do, if they have another disability.
Academic,
Academic, autism, impaired, anything like that. So that's an advantage. But let's talk about, and so I want to have the parents continue to focus on the app and just remember, just like what you said, if the children have that 30-minute session with you, because children that have speech and language, they don't have long sessions.
No.
And so if they do that 30-minute session with you and then do the practices or whatever activity you have, or information that you give them, or information on the app that they can access, their child will grow. And so hearing, and what we need to continue to remind parents is that it's twofold.
Yes,
ma'am. That piece where they come and they see you because you're the expert, and then they use your app, and then they still have to implement at home. So doing that work, the village concept, stakeholders.
Exactly. Yeah, the continuity of services. And then it's just like having me in your living room. So you can have one session a week, but if you go home and use the app to its maximal ability, then you're able to have 4 sessions a week if you really look at it. It's just like, I like to compare it to a doctor's office. You go in, you get seen, you get your medicine. But they don't give you one pill. They give you a pill for 10 days or 7 days to assist with getting over the problem. I'm giving you the pill for what it is that you need to work on, and you'll get over the issue quicker.
Yes. So let's move. April is Autism Awareness Month. So about
my favorite.
And so it's crazy because I love special education. So many parents, they see that negative label. And I'm like, guys, if you just look at special education and just the benefits from special education, your child will fare so much better, wherever they are placed, because of the accommodations and the modifications and everything, that
interventions, everything
they have access to. So I try to teach my parents, if you use it to your advantage, your child will do so well.
Yeah.
And so I out of all of the disabilities just named under special education, I love my autistic babies. Like,
me too.
It's something about them. I love
yes.
expecting
I do too.
They're so quirky, and
every case is different.
Yes, every case is different. So you have the high functioning, those that are in the middle, and then you have the low functioning. And so, and I love the one children that have the speech language, the echolalia.
Yes, it's so funny, isn't it?
It's so
that is actually a goal that stop doing that.
Right. So I remember the first time I heard it, and I was just like, what?
Right.
I said they're so unique, and they function differently. And I love the fact that they're in their own world. So let's talk about them and just the way that they communicate. Because when you look at a child that has autism, one of the characteristics is, the social interaction and that communication piece, and then just them being consumed with just one thing.
Yes.
I'm going to talk about the communication piece today.
Okay.
So, with communication, what are some strategies? Because again, we have different levels.
Of course.
And so we also have assistive technology to assist them. So what are strategies that a parent who's in this pandemic right now, and they're like, listen, the school was doing everything.
Yeah.
Everything. And so now I have my child at home with me all day. What can I do to help them effectively communicate their wants and their needs?
Okay, so definitely, I would say there are two ways that you can definitely address this. So, if you have a child who has received speech and language pathology services and they actually have goals that they're working on, I would say to maximize the goals. So, I'll go over a few in a second, but maximize their goals, and then also reach out to your provider to see what it is that you can do to carry over what it is that they were taught in the session. So right now, most of my caseload is actually ASD, which is autism spectrum disorder, or have been diagnosed with that. And I've seen that during this pandemic right now, a lot of them cannot be serviced because it's more
Right.
of a teletherapy based treatment.
Right.
So it is going to be harder for you to service a child with such needs. However, that does not mean that it cannot be done.
Right.
So the first thing that I would say, excuse me, is just to make sure that you have been in touch with your speech and language provider so that they can give you your individualized needs, whatever the child needs individually.
Right.
So, so that you continue so that the child won't regress in the progression that they have made.
Can I put a pin right here?
Of course.
So we talked about this the other day, and I talked about this on my other interviews as well.
Okay.
For parents who have children with special needs, it is it's critical that you not only just talk to their special education teacher, but that you reach out to every service provider. That's occupational therapist, the speech language, pathologist, physical therapist, the counselor, even because they're a stakeholder, the regular ed teacher, and the special education teacher. I think I said that. So you need to talk to everybody, because this special ed teacher and the gen ed teacher is not going to provide the same services as the speech language pathologist.
Of course.
You must be in contact with all of the service providers. Go ahead.
Right. And then also making sure, just to piggyback off of that, making sure that you are on the same page. Annually, we hold meetings for the parents and everybody. And this, I'm talking school-based right now.
Right.
I have a private practice, but I did participate in school-based therapy as well. But making sure, just like Ty said, making sure that you are on the same accord, because generally all of the specialties are on the same accord.
Right.
9 times out of 10, the parents just might not be on the same accord, whether it's, they don't really understand, or they need a little bit more questions answered, or whatever the case is. But making sure that all of the specialties are on one accord, because you can talk to everybody, but I need to know what you might be doing, Ty, as a special education teacher, so that I can encompass that into my lesson. And you might need to know what I'm doing so that you can prompt a sound, your session, or work on following directions in your session. So that was an excellent point. Excellent point. And that goes definitely with private practice. If my children at my practice that I'm seeing, and I tell my other clinicians this as well, if they're receiving any other service, we need to be on the same accord.
Right.
So I am in contact with their teachers. I'm in contact with their speech pathologists at their schools. I'm in contact with their ABA therapists. So I am definitely in the loop. As
them as well, the ABA. The behavior therapy.
Oh, that's a major therapy for autism.
That is very important. I'm sorry, I forgot about that. And so just to interject quickly, parents, and this is again what I try to empower my parents and remind them that it's important to know what is going in your child's IEP. So you must be familiar with the IEP so that you'll know how many hours does my child receive in speech and language or in the special ed program, because your child may be able to be in the general ed classroom but still be pulled out for special ed services. And you need to make sure that you are aware of goals and objectives, and that the goals and objectives match where they are.
Your child's growth,
Yes, all of these things we as parents, and I always say this, that we have to be able to advocate for our child. And so
Definitely.
the communication piece is, what can we do as parents at home to assist our children, children that are on or have autism?
Sure. So sorry, we digressed a little
I
bit.
know.
But so the first thing I would say is structure.
Yes.
Children who are on the spectrum or have been diagnosed with autism spectrum disorder need structure.
Yes.
You are a parent who is not used to structure and your child has been diagnosed with ASD, please get used to structure. It won't harm you. This will only make your life better. I promise you.
So much better.
And then and then also the parents who have already kind of adapted this structure mentality, those parents are now well aware of what their child needs. And in those situations, they're already using communication boards and picture exchange system. So the first thing I would say would be definitely to focus a lot on structure.
Can we talk about the picture boards
Yeah.
and communication system? Because I want to talk as if parents don't know. So educators were like, oh, just implement the picture communication system. And they're like, well, what are you talking about?
Right.
So we do it at school.
Yeah.
But at home, what does that look like?
So exactly. So the picture exchange system, and I was actually looking for one, see if I have one in my office, and I don't have one in here, but there's one in the clinic area that I do have. If you wanted me to go get that so they can see it, I don't know if you wanted the visuals or not, but a picture exchange system. Okay, so you have low-tech devices, and then you have those high-tech devices that Ms. Ty had spoke about a little earlier. So right now, because I have a younger population, a lot of the times I'm using the low-tech device, but we do have a few clients who are high-tech device users. So what that looks like, it's basically either a picture exchange system is you're exchanging something for something else. That is the gist of it. For a transitional schedule, you can also use this as a picture exchange system. So that would look like when you wake up, you're going to take a bath, you're going to brush your teeth, you're going to put some clothes on, and then we're going to go downstairs to the table for a puzzle activity. So what you would do is you have the picture of the bath, you have the picture of your child brushing their teeth. You'd have some type of picture of the table. You have some type of picture of the puzzle or a potato head. You give them choices of what they want to do. So they will hand you the puzzle or the potato head. There are more logistics to this, but this is just the easiest way of putting it. And sometimes your kids they also might need the hand over hand assistance for you to assist them with making those choices. Right. And that's just basically taking their hand and picking it up and say, hey, okay, Bobby, you want the puzzle? You want the puzzle? Look at puzzle. All right, you want the puzzle? We're going to do the puzzle for 10 minutes. So structure is very important as far as, okay, now Bobby, he gets up, he knows he's projecting what he has to do. So once they get used to projecting what it is they have to do, transitioning will not be hard at all. Right. So this is how a transitional schedule and picture exchange systems can assist with transitioning. We know with children with autism spectrum disorder, they have a very difficult time transitioning as well, even if this is something, most of the time when something is highly reinforcing. Right. So if they have a toy car, or if they just really like their sleep, or say if they have your phone, the transitioning schedule will give them a visual of where it is they're going, and then also prompt them, okay, when the timer goes off, that we have to go to this next activity. So along with the picture exchange system, along with the schedule, you can also use a timer. This timer gives a prompt to the individual the child to let them know, okay, this is coming. So that's basically how the picture exchange system works in regard to transitional schedules. With picture exchange system, and you can use anything you have around your house. Yeah. Don't be shy to use, you can take a picture on your phone and, prompt them with that. That is something. Yeah. So you might not have a printer to print out the pictures, but go ahead and take a picture and prompt them. The more visually that they see, the better they're able to transition between your day. And then also, not to say that they, you just have to have a schedule from 1 to 2, from 2 to 3, from 3 to 4, but making sure that most of their day is scheduled, and then using the picture exchange system will kind of guide them through the schedule a little better. I promise you, once you start using this, parents,
yes,
it's over. After a week.
Listen, it's such an amazing, but you have to, I love when you talk about structure, the scheduling and that routine piece. So all of them, they're married, they go hand in hand.
Right.
And once you do this over and over and over again, your child will begin to look for the schedule. And so a great place to put it is on the wall.
Yeah, on your refrigerator.
Right. You can put the Velcro on the back and then have a basket on the floor and then have them pull. And so say, oh, it's bath time, drop it in the box. Oh, it's bedtime, drop it in the box. And so, they're used to this every day. Another assistant.
And then if you don't have Velcro, get some tape. Because we don't, you don't sit home with Velcro. If I was, if I was a parent, I just would not have Velcro, but I might have some tape.
Right. So, so you can use any of these things. You just have to make it work at home. Another device that I like to use. And so you heard her talk about the low tech and the high tech. A lot of times when we talk about assistive technology, every parent wants an iPad. No. Yeah. Okay, no, we're not doing that. And so we want to, when we say assistive technology, we're not talking about technology like my phone or an iPad, but we're talking about devices or things that assist
that are specifically for that.
Yes. And so we talk about a pencil grip, that's assistive technology. We could talk about a slant board, that's assistive technology, or those picture boards. Another one I was saying is a Go Talk, and a Go Talk is picture based as well. And so the child can actually press the Go Talk and then it speaks to them. So that's another form of communication. And so you have a Go Talk, I believe, with 12 squares.
Yeah, they're Go Talks. They're with 2 squares. You have some with 4 squares. You have some with 12 squares, 16 squares. There's a very broad range of Go Talks. But if you do not have a Go Talk at home, please do not fret. Use your iPhone. And this only because these are uncertain times. And we're talking more about, these times. If you don't have a Go Talk, make sure you're using your iPad. There are some apps on the iPad that you can use. If your child has ASD and they are nonverbal, because we have some children who have autism spectrum disorder that are nonverbal, use your iPads. One of the apps that I'm using in my sessions with my children with more high-tech devices, which is the iPad, is the Smarty Symbols. I believe it's called Smart.
S-M-R-Y-S-A-S.
No, I don't. Wait, is that what is it? It's called Symbol Talk. Sorry, SYM.
Yeah.
BOTALK.
Yeah.
Okay. So Symbol Talk will allow you to actually it gives them a way to communicate. It has yes and no questions. So if you're going downstairs and your child wants some cereal, you can take out your iPad and it literally has, okay, Bobby, do you want cereal? It has yes or no. So they're able to press yes or no. Now, before you get to this stage and them actually being able to use it, you need to also teach them how to use it. So take some time in the afternoon while you guys might be watching a movie or a cartoon or, right before you eat lunch, prompt them and do the trials to have them pick a yes or a no by answering those questions. So in speech and language, yes and no questions are the easier questions to answer. So those generally are what we start with. So if your child is new to using the AAC device, which is the iPad, they might be using Symbol Talk, you can have them train or trial on the yes and no. And that's basically where I start at with my children who are using the AAC device on the iPad and using the Symbol Talk. Yes and no questions.
Got you. So one of the questions that I was going to ask you already covered, which I love because we're just having, like I said, organic conversation. Parents will say, well, what can I do at home? And so we're telling use tape, print off pictures, use the iPad. All of these things are ways to effectively help your child communicate at home, and you don't have to go out and buy anything extra. You don't have to have these fancy devices that she may use, at her, business that you may not have.
And I don't really use any fancy devices though, Ty. Honestly, I literally use either
I said tape on the wall.
Exactly. Tape on the wall. Or we have had some children go through some vendors and stuff to get actual Go Talks and actual AAC devices. But generally we use the resource of an iPad. Like I have about 3 here that we actually use for them.
Exactly. So let's talk about vocabulary. How can a parent increase their child's vocabulary? Because that is so important when you have children, with autism that are nonverbal. And so as a parent, you want that child to speak.
Yeah.
So that oral piece, and sometimes it may not happen at all, or it's going to take time. So what are some things to help the child communicate?
So communicate, I would say, well, I'll go to the vocabulary portion of this.
Yeah. I'm sorry, vocabulary. That's what I meant. I'm sorry.
So no, you're fine. So I would say when you have a child who is nonverbal, well, let's start here. With autism spectrum disorder, it is a scientific fact that usually 9 times out of 10 times out of 10, really, because I haven't seen any case that has been different from this, but their receptive language is definitely higher than their expressive language. And I'm going to break that down just a little bit so that, the parents can have an understanding of this. In speech and language, we look at receptive language and expressive language. Receptive language is everything that you recept, everything that you understand. Expressive language is everything that you give out, everything that you say. So that's how they're different. A receptive language example is, I'm going to give you a 3-step direction. I'm going to give you a 2-step direction or a 1-step direction. I want you to receptively understand what I'm saying, and then I want you to go do it, right? So that's receptive language. Expressive language is you telling me what it is that you want. You're telling me how you want it. And we know that children with ASD have just a very hard time expressing what it is that they want. In a situation like this, we also have receptive vocabulary and expressive vocabulary. So receptive vocabulary is Jenny knows everything that's in the cabinet. She knows the cereal, she knows the potatoes, she knows the chips, she knows the juice boxes, she knows all of that stuff. But expressively, she's not telling you what it is that she wants. Right? So receptively, she can understand that these are all the things. Now in speech and language, we have to take your receptive vocabulary abilities and get you to express what it is that you want. Right. And working on vocabulary, how would you do that? So when you're working on expressive and receptive vocabulary, I always tell my parents, when you're working on vocabulary and you want them to say something, the question is not, do you want? Because all they have to do is give you a yes or no. The question is, what do you want? Versus, so you're trying to give them that open-ended question versus a closed-ended question.
Amazing.
But also what I was going to say is making your environment language-based. If you're
labeling everything.
Yes. Like that is just amazing. Like I had one of my parents last night, because I talk to my parents, like not my actual parents, but my children's parents.
Okay.
So she texts me all these pictures. She's like, Miss Tina, I made the environment language based. He can't just go get what he wants to get. And that's what I told them. If they're going to get what it is that they want to get, what do they need to talk to you for?
Exactly.
What do they need to say chips for if the chips are in the pantry at the bottom and they can reach them? Right. They're not going to ask you for it because there's nothing to ask you for. Right. So what we have to do is make the environment more language-based. If you can't move the chips from the bottom of the cabinet, lock the door.
Right.
Then your child has no, they can't say anything else except door.
Yeah.
door or chips or
Yeah.
something like that, because I guarantee you they know already. Their receptive language is way higher than their expressive language. They're like holding all of this stuff like right up in their head, and we're trying to get it out of them.
Right.
So I would definitely say make your environment language based. Like Ty said, put some pictures up, label everything.
Everything.
Label everything. And then I don't even want to make this seem like it's about ASD, because I've been in people's houses who have like serious OCD and everything is labeled.
Yeah, I mean, your regular children need word walk. You know,
Exactly.
children that don't have special needs, they
Right.
need word walls. They need
Yep.
like, because this is how you build vocabulary.
Yeah.
You know, and that's where you see that word gap closing in literacy. You know, and yeah.
And a lot of people also, I don't think that we realize that what it is that we see is what we grasp onto.
Yeah.
So if your child sees this every single day, I mean, you might change your word wall up, every month, but if they see this every day, I guarantee you that that's just like with sight words. You're supposed to see a sight word and know the sight word.
There's
If
no
your child is right, so if your child is seeing all of those words on the wall and you're going over them every day, they're going to be able to say them.
Yeah.
Make your environment language based so that you can pull out what it is receptively that your children have in their heads, because there is something up there.
Yeah, amazing.
There's a lot of stuff up there.
This is such good information. So this is hard. What can we say to parents who have nonverbal children? Like, what advice could you give them? What are some words that you can offer to assist them when they know their child will never speak? You know, because it's hard. It's hard. You know.
So what I would say in that regard is a younger child, I would say using ASL, using American Sign Language. So start with the more, start with the thank you, start with the please, start with the help, start with the hungry, start with the drink. Very, very simple signs, right? And then I would say that I would not even think that my child would not ever be able to communicate. So we have verbally speaking, you can give verbally, you can say what it is that you want, but this is why we have AAC devices. They're called augmentative communication, alternative augmentative communication, which is AAC. So that's what we were talking about as far as the iPad. That's also considered an AAC device. Have them start learning those devices. Get on Symbol Talk. There are tons of pictures, tons of directions. You can put things in sentences on Symbol Talk. Start with yes and no. It's not that your child won't ever be able to communicate. It's only that they won't ever be able to verbalize if this is the situation. But you don't need verbalization in order for you to communicate or for your child to communicate. That is the biggest misconception. You do not need your child to be verbal in order for them to communicate. There are some devices that a child can communicate with their eyes. I mean, literally, and communicate with their eyes. So the sky is not the limit for you guys. And I don't want you to think that just because they're not saying anything now, they won't be able to communicate with you later. That is the biggest misconception.
I think that, it's all about shifting our perspective.
Yes.
And so when we think about, our children, we have this world's perspective, this worldly perspective where we say, I need my child to look like this, to be like this, to perform like this. And because we see this, my child has to be a straight A student and they have to do all of these things. And instead of just accepting our children where they are, finding beauty in who they are and what they're called to be, and understanding my child may not be like another child. However, and just like you said, and I'm so glad you brought it home. I need to pass the collection plate because it was so good. When you said we look for communication because we want that verbal piece.
Right.
But your child, if you shift your perspective, it's communicating with you. doing it in a different way.
Mm-hmm.
I tell
Even crying, that's communication.
communication. And
Screaming, it's communication.
yes. And so as parents, we have to step again outside of the box, and we cannot focus on what another child is doing. We have to focus on our child, our and meet them where they are. And so a lot of times we don't want to move out of that comfortable place and say, you know, I have to do just a little bit more work than another parent. We want this child that we deem perfect, and your child is perfect. Every child is not going to
be individualized.
They're individualized, and every child is not going to be a straight A student. Every child is not going to have, you know, long curly hair. Every child, there are children with disabilities, and love them where they are, and meet them where they are. And notice, if your child you know, can't speak at the beginning, you know, or can't, you know, communicate at the beginning, but then they say one word, you know, 5.
That's a big deal.
That is growth. That's
a big deal.
Yeah. And so it's beauty in that. And when we find that beauty, and, you know, just thanking God that we have the ability to, you know, steward over, you know, be a good steward over our children, then we will be able to see things differently, and we'll see the blessing in it, you know. Yeah, we'll see the blessing in it.
Yeah, I agree. And then also, just to add and piggyback off of what you were saying about the normalcy of children. So I think that society and the world has shown us what normal is. So a lot of times we fall within those guidelines and think that if something is wrong, then my child is not normal or considered normal in the population, which is also a definite misconception as well.
It's crazy. They're like, I don't want my child in special ed.
Oh, I've heard that too. What's wrong? And so, and I wanted to touch on this as well. When you said that, you know, some parents do say that, I also let my parents know that if you are not getting a diagnosis, this will only harm your child. There's no way that I can go to the doctor's office and tell them what's wrong with me or give them my symptoms and come out and say, but I don't want anything for it. It's fine. I'll never get better, right? I'll never get better. Some of my families are like, you know, I don't want the diagnosis. And some people are saying, you know, I want it because I want all the resources that I can get. So just seeing it in a new lens and realizing that even though your child might be diagnosed with ASD, this does not mean that they are being limited in any way. You have to bring them to where it is that they can best be themselves. And it calls for intervention.
Yes. And I love what you said. At the end of the day, you hear the diagnosis and there's going to be that denial piece. And I get it.
Yeah, I get it too.
You don't want your friends and your family looking at you like, oh, she has a child, or he has a. Guess what? At the end of the day, you have to do what is best for your child.
Yeah, and I've seen a lot of families come together in that manner too.
Yeah.
A lot of my families come together when things are a little bit different. So I have grandparents bringing them to therapy and so loving up on them extra. It's like this extra love. So it might look defeating, but I think that if you are suspecting, it's not. And I think that if you are suspecting that your child does have some type of diagnosis, whether it's ASD, whether it's intellectual disability, whether it's trisomy 21, which is Down syndrome, whether it's an expressive or receptive language disorder or apraxia, it does not matter. Get that diagnosis so that we can better assist you. You know, you would rather your child, you know, I have a patient right now where, you know, they really don't want to be diagnosed with that, but they're only getting speech. So guess what? Their progress is slower, because if you were getting speech in OT, in ABA, in physical therapy, all of these therapies, the progress would be better. But as soon as you identify with that diagnosis, is the sooner you'll be able to get the resources that your child is due.
And not only that, there are some children, and this is what I tell parents, you have to see the end.
Mm-hmm.
At the end, not in the middle. Mike Todd preached about this. His son has autism, and he preached about this on Sunday. It's not about the middle. We get stuck in the middle.
Yeah.
And so, what you have to understand is that some children test out.
Yeah, some do, don't they? They definitely do.
Give them resources. So some children, they may not be in special ed forever, but you don't know, and some will, and that's okay.
And that's okay. Because would you rather them not get the services and go out and be frustrated and not be able to talk and then just shut down?
Right.
Getting the services, getting the help, getting the alternative communication, you know. Yeah,
to function, you know, when they get older. So, you know, just it's up to us as parents to do the work on the front end so that your child will have a successful life. And everybody's case is different, you know, but at the end of the day, we love our children. We want to make sure that they have the best life, and we have to be great stewards over what God has given us. Yes. Girl, like this was some good information. If they missed it, listen,
I did want to drop one more thing in there for a resource for parents. So with a child who has been diagnosed with ASD, one of the main things before language, before you can sit down and get them to do anything, before they can communicate with you, they actually have to sit and attend. If you're teaching them something, they actually have to sit and attend. They can't be everywhere, looking everywhere, or getting up from the table and running around. I would definitely say, and I mentioned this in my live last week, is the specific need for some type of, I can't find the word, but some type of a high chair will assist you with just having them sit and attend. So even if you have a big area in your house and they're not sitting and attending to tasks, I would say get the high chair, make sure they're in the high chair, not a long time. I wouldn't do the high chair more than 30 minutes, especially if they're not eating. Right. But have them relate that specific high chair or that specific place in your house that we're actually going to sit down and work and do something.
So create space. That's
a boundary. That's the word I was looking for. Sorry, guys. I was looking for that word, boundary. Yeah. We're creating a boundary because Bobby, you have to sit down and you have to finish this puzzle. Yeah. So even if you are, in my sessions, I don't have high chairs. So I give breaks. I give, one of the goals is Bobby will sit and attend for 5 minutes and then 2 minutes off. And as they do better with attending, they're able to sit for 6 minutes and 2 minutes off and 10 minutes and 1 minute off. And, and it increases like that. But if you're in a big space and you have something, you can kind of like barricade yourself in with your child and have them sit there and attend to a task for 5 minutes. Yeah. So just making sure that your environment is able to hold boundaries so that your child won't just be up and doing everything. Even when eating, a lot of times with children with ASD, they like finger foods. Mm-hmm. They're not going to sit still for long to eat.
Sensory.
Even with the texture, and they're not going to sit long to eat. So they're going to be up and running around. And then you find that your child has literally ran your whole household. And I'm not even kidding. Your child has literally ran dinner time, they ran breakfast time, they ran bath time, they ran activity time because you're conforming to what it is that they want you to do or their reactions.
You know what I think it is too, is because a lot of times parents, and I get it, you're saying my child has a disability. So because they have a disability, then, I feel sorry. And so I'm going to allow them to do certain things. Mm-hmm. But a child with a disability still has the ability to discipline, to follow schedules, to be on a routine, and to have routines, and to be able to follow through with commands. Yeah. And so, you have to be the adult, the parent, and you have to set those boundaries and say, this is what we're doing for 3 minutes, and then you have a break.
And that can go on your schedule as well.
Yes. Mm-hmm. And so we put those things in place so that your child will be able to thrive. Can you please give them your information, please, so that they can follow you and see the great work that you're doing?
Sure. So you can follow Pediatric Speech Lab at Ped Speech Lab. That's PEDSPEECHLAB on Instagram. We also have a very, very resourceful Facebook group. It's called Autism Ish. Sorry, I had some lint in my face. It's called Autism Ish, and ish is stuff, autism stuff. So we have we have people in the group that just talk back and forth. Some parents ask questions, some parents ask strategies. And guess what? You have access to me, a speech language pathologist, direct access to a professional. This is the same thing with the app. You can find the app in the Apple App Store as well as the Google Play Store, I believe it's called, for Android. And it's called the Speech Lab app or Pediatric Speech Lab app. You can look up both of those and you'll have access to parents. There's a blogging spot for parents, for clinicians, and for teachers. Like yourself, Ty, and you guys can go in there and talk about different strategies that you've used. Hey guys, this strategy used, or this strategy that I used was good, or you can go and talk to different professionals like Ty if she wants to respond, or myself, or any teachers or speech pathologists that get on there, as well as some other great things that are on the app as well. So feel free to reach us through Facebook, Instagram, as well as our app.
Oh my gosh, thank you. If you were just jumping on, please watch this. So much information, so many resources. Just like Quintina said, if you would like to get in touch with her on Instagram, I'm putting it up again, Ped Speech Lab. And so it's on the screen for you on Facebook, Autism Ish, the Facebook, and download her app in the Apple Store and then Google Play. Thank you so much.
And then also, if you wanted to reach us, sorry, Ty, if you wanted to reach us, you can go to our webpage. There's some intake forms there. There's information about our teletherapists, little bios. There's information about the company. There's a substantial amount of information about the app. So that is pediatricspeechlab.com.
Got you.
Yes, ma'am. Sorry.
Okay, typing it out.
It's
coming.
Yes.
It's on the screen right now. Again, thank you so much. If you're just joining, y'all, please go back. Thank you, Quintina. Wealth of knowledge, expert in her area. Just thank you so much.
I received that.
Our parents need this help. And so we'll be again offering more interview series. Parents, please share. Please tune in. This will be on my page. So share with your friends, share with your family. Because, we're trying to do the work on the front end. So during this pandemic, you won't feel like you're alone. Everybody is here for you. Please reach out to Quintina. If you need services, please download her app. Please follow her on social media and show her some love. Again, thank you guys so much for joining in.
Thank you for having me.
Yes, thank you so much. We appreciate it. And I love you guys. And I hope that you have a winning day. See you soon.
Bye.